Homelessness is an issue affecting a growing number of Ontarians. At the beginning of the COVID-19 pandemic, advocates and experts warned that people experiencing homelessness would be at higher risk. The reasons for this are simple. First, those without housing don't have somewhere to quarantine, self-isolate, or often even to physically distance themselves. Second, the homeless population has a high rate of health conditions known to increase risk of COVID-19 complications. Using a new method that leverages hospital records, we identified and followed people recently homeless in Ontario over the course of the first wave and compared them to the general population in terms of their rate of COVID-19 testing, infection, and complications related to infections. Since testing policies changed during the first wave, and obviously testing impacted case numbers, we made sure to measure the hazard of having outcomes when testing was restricted to priority groups, like those who are homeless, as well as when it was not. We found that the recently homeless were at higher risk of being tested and testing positive for COVID-19, even when testing was equally available. We also found that this group was over 20 times more likely to be hospitalized for COVID-19, more than 10 times more likely to be admitted into intensive care for COVID-19, and over 5 times more likely to die after infection. In other words, our data support what experts were saying all along. People experiencing homelessness are especially vulnerable to COVID-19. Policymakers responding to the pandemic should continue to implement as many strategies as possible to prevent infection in this population, and they should acknowledge homelessness as a key risk factor in their response more generally. In our next study, we will be looking at the indirect health consequences we think the pandemic may have had on people experiencing homelessness.